And then I still haven't actually talked about the veteran thing. So this is like the most long-winded, disjointed answer ever, bro. I apologize. The veteran piece comes in because we had this microdosing program where, separate from the jiu-jitsu retreats, we were teaching people how to get into microdosing, because my wife and I have worked with this stuff for years. And it started off just as like one friend kind of hits us up and is like, hey, I'm interested in this. Can you like tell me what to do? Mm-hmm. And we would just kind of give some advice and point them in the right direction. And then they would, without fail, come back for like more advice, or they had questions, or stuff was coming up that they didn't understand how to process and they kind of needed help to move through it. And so we started like actually charging for it, because people take things more seriously when you actually pony up a little bit of money for it. Yes. And we would structure it as like, you'll have 3 calls with us or whatever. We'll give you some advice, like take the microdoses, come back, we'll talk about it. And it quickly became obvious that just wasn't serving people as good as we could have been serving people, right? Like it became clear that people needed more and that we were able to give them more coaching, more help. And so we started fleshing out this entire 3-month structure. Like we built it into a 3-month training plan, if you will, just like I was doing with like a 3-month rehab program. It's almost like a rehab program for your mental health. And so we started rolling this out. We enrolled some people in it. And then honestly, I think it was just because I had a relationship with Seb already, and he kind of saw the stuff that I was doing. He put me in touch with Toby, and he was like, hey, dude, this guy needs some help. Maybe you can help him. And put Toby through our program, took him down to Peru with us, and saw how much that changed his life, how deeply that changed his and his wife's life and relationship. And then Toby just started talking about us to like all of his friends. And so it just very naturally occurred that we all of a sudden had 10 veterans come talk to us who wanted to sign up and wanted to go through this program. And so the process is now just sort of iterating, where I just had this other guy, Damien, also Canadian veteran, go through our microdosing program, come down to Peru with me. And he has like, I don't know, 180,000 followers on Instagram, because he's like this famous artist. And so it's been like a very organic thing. I never set out to like, I want to help veterans. It just kind of,
they're just knocking on your door like, hey, you're the dude that helps veterans. Like, I guess so.
Yeah, I guess I am.
I help people. You just happen to be a veteran. Yeah.
It's kind of funny though, honestly, because that happened when I worked at this PT clinic. I developed this reputation as like the guy to go see for like chronic pain patients, depression, fibromyalgia, and like cancer patients. They like sought me out in the area because I just like fucking listened to them, and I was like a nice person. And that's actually a novel thing for a doctor to listen to you. And so I developed this reputation, and like all these people referred all their friends to me. And my entire caseload was like these old grumpy women with like fibromyalgia or breast cancer. And, it was interesting, but it's almost like the same thing has happened here, where kind of one person, I just stumbled ass backwards into helping one guy. And turns out we were actually really good at helping him. Mm-hmm. And I think that, my communication style and all of my skills as a physical therapist, like bringing that all to bear in this sort of context, it turns out I'm actually like very good at this, and the results speak for themselves. Like, I don't mean to sound like egotistical when I say that, but like anyone who fucking knows Toby before and after, like, the difference. And I don't personally take credit for that, but it's just, we've created this program where you can't like that. Those results are almost, it can't not happen. If you follow the structure that we've created, if you work with the medicine in the intentional way that we teach you to, and if you commit to it and surrender to the medicine, and if you're on board, it's going to happen. So that's a super long-winded, not very coherent answer to your question.
Okay. It's great. We're a long-form podcast here, so that's exactly what we're looking for. We're looking for that long, drawn-out story, which meandered to how you got to actually help veterans in a tangible way.